Hey there, my name is Megan Clanahan. I'm the co-owner of Houston Moms, and it is time for another monthly health video with our friends and partners at UTMB Health, our preferred providers for the Bay Area, League City, Clear Lake, Galveston, all of you down there in the Southeast. UTMB Health is who we recommend for you. We bring you these monthly health videos every month. And this was something that we kind of brainstormed a couple of months ago that we kept getting questions about. And so we thought we would bring in an expert who could answer some of your questions. And it is about ear tubes in your children and what that looks like in the process. So today we have with us a new doctor to UTMB Health, Dr. Hajiyev. Thank you so much for joining us.
And thank you for inviting me.
Yeah, absolutely. Can you tell us a little bit about yourself?
Yeah, my name is Yusif Hajiyev. I am a pediatric ENT attending at UTMB Health. So I was practicing for a long time, and I did my fellowship at Texas Children's Hospital. I just recently joined UTMB, and I am ready to serve for all pediatric patients in that area.
Perfect. Well, we love our friends at Texas Children's, and I know UTMB Health will be a perfect place for you to land. So we're just going to dive right in. Let's say a provider tells you that your child needs tubes, ear tubes. What does that even mean? What should a parent expect when they hear that?
Yeah, so thank you for that great question, because this is the most common condition which we are facing with the children in our area. So first of all, don't worry and stay calm. It's a very little problem in the pediatric ENT area, and the provider may be telling you this option if your child has suffered multiple ear infections, causing your both to be very frustrated and tired. So tube placement are usually indicating my followings. Like if your child has had more than 3 or 4 recurrent ear infections in the past 6 months, or if your child failed a hearing screen and has persistent middle ear effusion or fluid in the middle ear. And as a result of multiple ear infections, or eustachian tube dysfunctions. The eustachian tube is a tube between the ear and the nose, which is located in the between of that area. And usually this in the pediatric population, this tube is too short. And so for that reason, when you have an upper respiratory tract infections, then it can lead to the ear infections as well. So if it's happening very often, then probably your child may expect some recurrent ear infections, and because of that result, your child might develop adhesive otitis media, which also require the tube placement. So the doctor has suggested your child have an ear tube surgery, and then the doctor will make a small cut in the eardrum, and this tiny pressure equalizing tube will be placed in the opening made in each eardrum. So with that procedure, the pressure which is located in the middle ear will, like the place of the pressure was released and the fluid will come out. And so having this surgery does not mean that your child will never have another infections ever. So, however, it is very likely that he or she will have a fewer ear infections than before. And any ear infections that does occur should be less severe, of course. And the tiny PE tubes also may help your child to hear better. And also, don't forget that the PE tubes are not a magic cure for all ear problems.
Okay. That is great information. And so I know there's so many moms out there, we have had a lot of sleepless nights where, our children, when they have that ear pain, it's excruciating to watch them go through this over and over and over again, and so many antibiotics, trying to get rid of them, all of that. So I'm so glad you talked about the conditions that would kind of lead to what an ear tube surgery would look
Yeah.
like. So, are there any, I mean, how many kids, like, what's a percentage of children that would end up needing ear tubes? Because I feel like it's a pretty common thing. You said it was one of the most common things that y'all see, right?
Yes. So, like we, like probably if your child is having the recurrent ear infections, so the number like 2 to 3 per year is normal. We are not planning to, like, we are not expecting to put the ear tubes in the children who is having like 2 to 3 times ear infections per year. This is normal.
Okay.
But if this number more than this, especially in the last 6 months, child are expecting 3 to 4 more recurrent ear infections, as you said, as you mentioned before, like in like the pain, and also this antibiotic usage, which is prescribed by the PSP. So this small procedure, this small intervention can help your child to avoid this kind of problems in the future.
Yeah. Is there an average age that most children that you see for ear tubes? And how old are the kiddos that you're usually seeing in clinic?
Starting from 6 months, we are like expect, for example, if the newborn failed the hearing screen and there is a persistent fluid in the middle ear, which is not able to clean by the antibiotic therapy or any like time period, then you need to consider about the tube placement, even if the child like 6 months of age.
Okay.
So there is not like the lower limit is 6 months, but there is not like up limit. And
Okay.
we can have the ear tubes any age of like up to the 16 as well.
Okay. I guess I feel like, at least for my kids, like we haven't had ear infections. They're 12 now. So we haven't had persistent ear infections in a while. It just feels like when they're like, I guess in that like 18 months to like 4-year-old range was kind of when we had a lot of ear infections. So now speaking of the ear tube surgery, you kind of touched on that. What kind of side effects, if any, can you expect from an ear tube surgery?
Yeah, of course. But before that, I'd like to provide a little more like information about why the children having the recurrent ear infections, right? What's
Okay.
the reason? Because so like when the children are growing up, then becoming older, the ear infection, the numbers are going down. So the main reason is the anatomy of the ear. Because the eustachian tube is short and straight, when the child is when the child is small, then the upper respiratory infection can easily go to the ear very easily, because the way is too short and the tube is straight. When the children are growing up, this tube become longer and is starting to curve. So for that reason, the infections are starting to come down. This is the one reason. The second reason, when when the family is planning to put the children to the daycare, this is a new environment, and they are facing with the multiple microorganisms which are going to enter the body, and they can cause the multiple other like type of infections, such as the throat infections, ear infections, or the upper respiratory infections, or even the lower airway problems as well. So this is another reason. The third reason, which is not very common in the United States, but I'm also seeing that problem as well, this the families where the children facing with the passive smoking, like passive, if the family members smoking at house, then these recurrent ear infections are they are under the serious risk to having the recurrent ear infection. These are three main reasons which are facing, which when you're looking for the reason or the ear infection, then you will find out these three main reasons underneath.
That makes so
For
much
your
sense.
question,
Yeah. No, I was just gonna say I haven't heard it put together that way, and I was wondering why. We haven't had an ear infection since we were 5, but the eustachian tube thing makes so much sense. Their bodies have grown, and now we're draining better. So
correct.
perfect. Yeah. So
Yeah.
thank you for doing
About
that. Side effects. Yeah. What can we
yeah.
expect?
Yes. So, so before, like, let's say that we place the tubes in the eardrums. There is no significant side effect after the procedure. Ear tubes or tympanostomy tubes are temporary in nature. They usually stay for approximately 6 to 12 months and fall out on their own. Most children hear better with tubes, but still some still get ear infections, which are usually seen as the yellow or smell drainage from ear, even with the tube in place. This can usually be treated with an antibiotic ear drop, or often oral antibiotics can be avoided. The eardrum usually heals itself when the tubes fall out, but occasionally, like 1% of the time, surgery is needed to close the hole when the children are older and have outgrown their ear problems. So this is a very low percentage of the side effect after the tube placement.
Okay.
So yeah, that's the answer to your question, I think.
Yeah. So so pretty low risk surgery
Yes,
for
correct.
a high benefit, right? To get back to like
Yes.
some quality of life. And so we talk about them, they'll eventually fall out, all of that. What do you do if your kid needs, we live in Houston, so we want to go swimming all the time. We can swim like 10 months out of the year here. What are the rules on swimming in water and, dunking their head in the bath? What does that look like for a kid with tubes?
That's the perfect question, and this is a common question which the family is always asking after this procedure. So after the surgery, we are usually giving some ear drops, which are often used for the several days after the surgery to prevent ear infections and help the ear heal. If the ear has any drainage, then the drops can be used longer to help to clear the drainage. So, and also we are strongly recommended dry ear precautions, but usually we recommend to use some ear plugs, but many doctors believe that the ear plugs are not necessary for showering, but bathing without head submersion, and also rain and playing in the sprinklers is not like the earplugs are not necessary.
Okay.
But the recommendation is to put the earplugs when to avoid the risk of the ear infection. It's a head submersion in the bath water, head submersion in the public swimming pools, lakes, or other contaminated waters, and diving more than 6 feet underwater, even in the clean water. But
Okay.
I think the sea water or the ocean water is not the problem because it's a salty water, but I don't think it's a very big problem to having the salty water in the ear. But the other type of water, I think you should put the earplugs before head submersion.
Okay. And so that's at any time after surgery until they fall out. You should have earplugs.
Correct. Yes.
Unless you're swimming in the bay in Galveston, I guess.
Yes. Yes. That's right.
Okay.
That's right.
So let's talk the surgery itself. So quickly, can you tell me about how long the surgery takes? And I'm assuming it's outpatient, right?
Correct. This is an outpatient procedure, and if there is only ear tube placement without any adenoid or tonsillectomy, then we are not intubating the patient. We are giving some sort of gas to get a child asleep, and then place the tubes in 5 to 10 minutes, and then after 2 to 3 hours, we are, after our evaluation, anesthesiology evaluation, usually we are sending patient home. And so after the surgery, usually, as I mentioned before, we are recommending to use ear drops for several days.
Mhm.
And then if the family will expect some otorrhea, which is lasts longer than 2 weeks, then we are recommended to call ENT office or their PSP. And also the usually next evaluation is usually happening in 6 months. Like we are following the next, after tube placement, the ear tube check is usually happening in 6 months after the procedure.
Okay. So this is going to be such a random question, but as a mom who of 2 kids we never had tubes, I'm just curious, and I'm sure there's moms watching who, are kind of getting into this and their kids haven't had tubes yet. Do you know when it falls out? Is it like an obvious thing when the tube falls out? Like, does the kid find it?
If the family really curious and always checking the ears, they can see that there is a small colored, there's a multiple color. The tubes are coming with the multiple colors. There's a white tubes, there's green, there's blue, there is sometimes like 10 years ago, there was a gold tubes, like the gold, actual gold tubes. Yeah. Then there was the tube with which covered by the actual gold. So if the family is too curious, they can see that the small, tiny tubes, which is can come out of the external ear canal, and they can realize there's a tube is coming out. But usually it's not working in that way.
Okay.
If it's fell out, probably you will never see in this this tube. It's even us, when we are looking at the ear canal, if the tube is there, we can see it with a little bit big looped device.
Okay.
But if the tube is not there, then it probably fell out, and we never saw it when it happened. It's hard to say.
Yeah, no, I was just totally curious, because I'm thinking, when our kids' teeth fall out, we keep them in a box. Do people keep their kids' tubes in a box?
Correct. Yes.
I had no idea. I know we kind of hit on a lot of points there, high level for what you do. Is there anything you would like to share additionally for ear tube surgery and what moms can expect?
No, I just wanted to say that if your provider telling you that your child need an ear tube, don't be scared. This is a very, very easy procedure for the ENT physicians and for the family as well. This is a one-day outpatient procedure, which is tolerating by the children very well. We are not giving even the pain medication of the procedure because there is no any pain after the procedure at all. So just don't be scared, be calm, and find a good provider who can take care of your children's ears.
That's excellent advice, because we need these to to work and to function, and it's so critical for our children's development. And as we always say on these videos too, y'all have your primary care physician, so that way they know how many ear infections that your child has had, and then they can refer you to an ENT. And so for UTMB Health, they do a great job with their comprehensive care. So if you have a primary care, they can refer you right over to someone like Dr. H right here, who can get your child situated and out of pain, because we know that's our ultimate goal. We don't want to see our babies in pain, for sure. I appreciate your time with us today.
The last one thing, I just wanted to warn the moms that when your child may have a very severe ear pain, especially in nights, don't be scared. Give some pain medication. And even if you see that there is some purulent drainage coming from the ear, you also can see the blood. Don't be scared. This is normal. Even there is a clot, there's a lot of blood in the ear. This is normal, okay? And after that drainage, after that, I don't know, like maybe some blood will mix with the drainage, your child will calm down because the abscess will drain out, the pus will come out, and your child will be calm down and pain will gone. Just be calm and don't be scared. Don't give some pain medication and wait until morning, and everything should be fine. And find your PCP, and they will take care of everything rest after this problem.
I think you would have to tell me about 8 times to be calm if there was blood coming out my kids' ears. But yes, I mean, I think that is important for all of us moms. You know, we have to put on our mom face. So with that, we keep our kids calm during that, because I think when they see us get really excited or scared about something, then that makes it even worse. And so good advice there. Thank you for joining us. And
Thank you for inviting me.
yeah, no, this has been great, a great discussion. And we are going to drop the links to ENT services in the comments below, as well as just how to find a general provider at UTMB Health. And of course, as a reminder, they are a preferred provider for the Bay area, Galveston, League City, Pearland, all you folks down there. You can find a doctor like Dr. H or many of their other practices that they have, and anything that you need. So we appreciate your time today, and we will be back next month for our last video of 2022, which is hard to believe, but I will see you guys then. Thank you so much for joining. Bye-bye.